OK, so I was a little optimistic on Friday. The flattening of Victoria's infection curve was just a pause for now. On the weekend and again today, we've seen well over 100 infections in that state, the highest numbers they've had. And what's happening in Victoria now is almost entirely homegrown. There are very few cases in that state that have come in from overseas in the last week or so. And sadly, as you just heard, 2 more deaths. One man in his 60s, the other in his 90s. Both died in Victorian hospitals. But still, again, we have to call for some perspective here. There are so many in the media and politics running quite alarmist lines. For context, keep in mind that there are 35 people in hospital across this country with coronavirus right now, all but 4 of them in Victoria. 35 people all up. And remember, we spent billions of dollars getting critical care bed numbers up to 7,500 nationally in order to make sure we could cope with the pandemic. We more than tripled our critical care bed numbers. We added about 5,000 critical beds, and right now 6 are being used. 6 people are in intensive care nationwide, 5 of them in Victoria. Now, this is traumatic for those people and their loved ones, of course, but the low numbers mean we are in good shape as a country. Victoria needs to get on top of these outbreaks for sure, but it's disappointing to see more borders being closed, especially that border along the Murray, now the border between our most populous states. Apparently, the decision was made today during a 3-way phone hookup between the New South Wales and Victorian premiers and the Prime Minister.
I had a conversation with the Prime Minister, I've had conversations with Gladys. All 3 of us agreed that this was the right step to take.
Yet this decision is a direct backflip from what Gladys Berejiklian and Scott Morrison have been saying. This is what they had to say in May.
The national medical advice that came from the expert panel that has driven all the other decisions never recommended closing borders.
And we've seen already cases go up in some states that have closed borders. Closing a border does not prevent you getting cases. It doesn't prevent people from getting the virus or spreading the virus. And what it does is it hinders our ability to get some of those jobs back the nation has lost.
All that is history now. The border closes tomorrow night at midnight. And even with just 600 active cases, the Victorian population of more than 6 million people will effectively be cut off from the rest of the country. And the New South Wales Police won't be mucking around.
It's a very long border. Someone could choose to swim across the river, walk through the bush. There are dirt tracks. We'll be using drones and other aerial surveillance at the same time.
He's not talking about the Rio Grande there. He's talking about the Murray River. And rather than be embarrassed by her change of heart, Berejiklian is using it to call for the border with Queensland to be opened.
Now that New South Wales has taken this decision, and given where we are, there's really no excuse for any other state apart from Victoria to have any border closures with New South Wales.
Now, this is a very worrying situation, but far from disastrous in Victoria so far. And we've ended up with even more hard borders in this country. Remember, we're going to be dealing with this disease without a vaccine for months, if not years to come. So if we're going to shut off whole states for 100 infections a day or a total of 600 or 700 active cases, then our country is going to struggle to operate effectively. State borders are totally meaningless and impractical boundaries in some places like Tweed and the Coolangatta or Albury-Wodonga or Mildura and Boronga. Yet now they're to be divided. Watch out for some Premier, or they'll want to build a wall. I thought we were supposed to be all in this together.